Sherry Boschert reporting for Global Medical News Network at the International Stroke Conference in Los Angeles. 25% of strokes are in people who don't know or can't communicate the time their symptoms started. Dr. Dong-Wha and his associates at 6 South Korean medical centers studied a way to help some of these patients.
Let me give you an example. A man went to bed at 11 p.m. at night and woke up at 6 a.m. in the morning and to find himself having a weakness on the left side and slow speech. When did the stroke symptom begin? So it's kind of a mystery because it could be any time between 11 p.m. and 6 a.m.
Patients with unclear-onset stroke traditionally don't qualify for clot-busting drug therapy because of a risk of bleeding. In Dr. Kang's study, patients who presented to emergency departments within 6 hours of noticing their stroke symptoms were screened using MRI imaging to determine if treatment might help them safely. Dr. Kang showed us 3 examples of MRIs in patients who were treated or excluded based on MRI findings of perfusion-diffusion mismatch or the extent of brain tissue death. Patients were treated using endovascular approaches, IV TPA, or both.
And we screened 430 unclear-onset stroke patients and treated 83 of those who met the eligibility criteria. And serious bleeding in the brain and with any neurological decline occurred in 6% of those, and about 45% of the people had good clinical outcome. These results are very comparable to those of previous benchmark studies, thrombolysis studies in clear-onset strokes. This is not randomized controlled trials, so it won't change the clinical practice immediately. But based on this observation, the larger randomized clinical trials are needed in the near future.
Dr. Robert Adams told us the findings are premature but encouraging.
I think their study was small. I think it showed that there was no alarming signal for bleeds. It's very difficult to determine from the outcome data provided that it's sure enough that it's going to be as effective as other therapies. You really need to have a clinical trial much larger than that, but I think that their study is important. It provides some impetus that we ought to pay attention to this.